Here we are halfway into the month of January. Surely by now you have set some type of a goal or a resolution for yourself, and chances are it's to stay healthier in 2021. Often that can begin with your teeth. So we're so happy this morning to check in with Dr. Michael Hernandez with Chattanooga Dental Care. Good to see you smiling this morning.
Hello, good to see you too.
So you were telling me that if you could give people one piece of advice, it is don't let things slip away. Make sure you're getting those teeth cleaned every 6 months. Why is that so important?
Yeah, it's not just so we can see your smiling face, which we love to do, but that interval has been decided on over the years because it's a good time to catch things that are happening before they become a big problem. 6 months could seem arbitrary, but if you were to wait for something for a year or 2 years, that's something that could have been caught small if we were seeing you every 6 months instead. So that's why dentists in general have picked every 6 months, and also there's some other reasons too. But we want to catch things when they're small, and we want to clean your teeth because that tartar buildup around your teeth every 6 months starts to get accumulate enough that it's time to clean it by then. So.
Okay, so let me ask you this, because some people might think, yeah, but I'm not feeling anything. I don't seem to have a cavity. My teeth don't hurt. I'm not bleeding. Why do I need to go every 6 months? So is it possible that there are problems there and you don't know it? As the patient, you don't know it?
Yeah, you cannot know it. The nerves in your teeth are unique in your body, unlike anything else. You can maybe compare them in some sense to the nails on your fingers or the hair on your head. The outer layer of your teeth have no sensation. There's no nerves that go to the outer layer of your teeth, just like the hair on your head. So you could get a haircut and not feel anything. If there's a cavity that's starting on the outer layer of your teeth, you have no way of feeling it. You don't feel it until it gets deeper into your tooth, where the nerves in your tooth can start to sense something going on there. And then it's become a bigger problem, maybe a little bit harder to fix.
In terms of insurance coverage when it comes to going to the dentist, I mean, that's for most insurance plans, this is part of your benefit, and people don't always realize that, right?
That's right. Most insurances, if you have insurance, they cover an exam and a cleaning every 6 months. So if you have insurance and you're not taking benefit of that, you should be taking advantage of that benefit.
Okay, so I'm sure there are people watching you thinking, you know what, the dentist is one of the few places I'm really afraid to go. That seems to be a common fear for folks. And I haven't kept up with it, and I'm almost embarrassed to call. Do you want people to not feel embarrassed?
Yeah, we don't want anyone to feel embarrassed. We are a no judgment zone. We have people who come every 6 months, and that's great. And we have people who have not been in a long time, and we love to see them too. Better to start at some time than not to start at all.
At your practice, Chattanooga Dental Care, are you the full family? Can people bring their kids as well?
Yes. Yeah, we're the full family. We have kids, we have young adults, and we have older adults. And what you were speaking of earlier about being afraid of the dentist, we're also a sedation practice, so we can help with people who have some serious anxiety or fear of the dentist. We also specialize in that.
So you are a parent. You have a new baby asleep upstairs, actually. So talk a little bit about taking care of your kids' teeth. For them especially, I guess it's important because they're going to have to get those fluoride treatments, right, when they come?
Yeah, they get fluoride treatments initially. The most important thing for kids' teeth is to start brushing them as soon as they develop teeth. In the pediatric aisle at the pharmacy or at the grocery store, you can find little finger brushes, a little brush that goes on your finger, but you could also use a small washcloth to kind of brush their teeth until they're a little bit bigger, and you want to get a little toothbrush. But as soon as they start having teeth, we need to start cleaning them, and then we can bring as early as 1 year old is not too early to bring a kid to the dentist. Usually parents don't bring them quite that early, but especially once they have several teeth, you may want to start their 6 month visits.
Okay, about a minute left. In terms of how long you should brush your teeth, do we not go long enough, most of us?
Most people do not. You want to brush your teeth for 2 minutes. So if you have a little timer, my son has a little sand timer that you can turn over, and some of the new electronic toothbrushes, they have a timer built in. But if you're brushing all the surfaces of all your teeth and getting them really nice and clean, it should take about 2 minutes.
All right, so here is where I can tell you in 30 seconds or less how to find Dr. Hernandez. His office, Chattanooga Dental Care on Shallowford Road. You can find him online at chattanoogadentalcare.com. The phone number is 799-4008. And when they come, Dr. Hernandez, will they check in by phone as a COVID precaution?
Yes, we've got lots of COVID precautions. They'll check in by phone. We'll bring you in one door and try to bypass the front as much as possible to try to limit contact with any of the other patients.
Excellent. Thank you so much for your time this morning.
Yeah, thank you. It was great to see you again.